It's one of the busiest emergency rooms in Western Canada. But this summer, at least 6 ER beds at the Royal Alexandra Hospital won't hold patients, even if needed, because the hospital doesn't have enough nurses. Just one of at least 2 hospitals facing such shortages. Alberta's health minister says that staffing concerns coming out of the pandemic were expected, but the nurses union claims that an exhausted and understaffed front line as we head into one of the busiest seasons in the ER could have been prevented.
Pulling through the COVID, going on 18 months, they're exhausted and demoralized.
The president of the United Nurses Union says she's been hearing from nurses forced into overtime to manage the staff shortage, saying last week's proposal by the government to roll back wages 3% didn't help.
At a time when we have a huge issue around deficits in the workforce, where we should be looking at retention and recruitment, we are in fact doing the opposite.
Those are two totally different issues. And again, this is the healthcare system. AHS has done an amazing job responding to a once-in-a-lifetime public health crisis.
AHS could not provide City News with an exact number of bed closures province-wide by broadcast deadline, but the opposition NDP estimates it's close to 100, although did not provide proof.
What we need to see is less antagonism with this government, more of a collaborative approach to actually sit down with the elected representatives of these healthcare workers.
But folks can only give all they've got for so long.
The union, representing many of the support staff in Alberta hospitals, says recruitment has been an issue long before the pandemic, saying they're watching concerning vacancy numbers for services like laundry, cleaning, and food.
You're advertising that you're going to privatize these jobs. How do you recruit in that atmosphere? So the government is really shooting themselves in the foot, saying they want to recruit into jobs that they're about to abolish.
Health Minister Tyler Shandro says hospital ERs are still open to treat you this summer, and there are still beds available. However, he expects staffing concerns to continue through much of July and August as AHS works to fill jobs. From Edmonton, Carly Robinson, City News.